Good day, everyone. So my name is Eric D. I'm an associate professor at the Faculty of Management. I'm the host and also the moderator for today's sessions for that. So welcome to the 12th annual Embracing Aging month. Before I introduce our speakers and also the topic today for that, we would like to thank and respectfully acknowledge that the UBC Okanagan campus is situated on the traditional, ancestral, and unceded territory of the Sioux Okanagan nations. Also, we'd like to encourage and acknowledge that you are joining us today from many places, near and far, and acknowledge that the traditional owners and caretakers of this land. So again, welcome to the 12th annual Okanagan Embracing Aging Month, and thank you for joining us today. So before going back to the topics for that, I would like to talk about the Embracing Aging is co-hosted by Beam Credit Union, Interior Health, and also the Institute for Healthy Living and Chronic Disease Prevention at UBC Okanagan campus. So Embracing Aging Month was launched 12 years ago to celebrate and raise awareness about positive aging and has once organized a number of educational opportunity and events during the month of March. So the sessions are designed for everyone, young and old alike, and also focus on a variety of topics related to healthy aging and ways to improve quality of life among seniors and their family caregiver. Our goal is to inspire everyone to embrace positive aging. So just some housekeeping rule for that. So we have a few dozens of attendees here for that. If you want to turn on or turn off your closed captions for that, so please feel free to hit the show caption or hide caption buttons on the menu bar at the bottom of this Zoom webinar page for that. So if you have any questions for our speaker today for that, and please kindly type your questions or comment for the speaker into the chat box during the presentations, and we will handle the Q&A sessions at the end of the presentations. And after these sessions for that, so please feel free to, and then fill up the survey. So giving some feedback about these sessions for that. And I'm hoping that you will enjoy today. So today, I would like to introduce my colleagues and also the wonderful speakers, Dr. Susan Holtzman from the Department of Psychology, and she will present the topic on social experience of chronic pain. So Susan is also the lead investigators of the Connections Health and Technology Lab at the Irving K. Barber Faculty of Art and Social Science at the UBC Okanagan campus for that. So please join me to welcome Susan. Please go ahead, Susan. Thank you.
Thank you so much, Dr. Lee. It's a pleasure to be here with you all this morning. Thank you so much for the invitation. As you can see here, I'll be sharing with you a conversation or engaging you in a conversation about the social experience of chronic pain. And you may notice some artwork actually throughout this presentation. And I want to acknowledge that this artwork actually comes from a number of entries into the annual Canadian Pain Society art competition. And most of these actually come from people with lived experience of pain and their healthcare providers. And I thought this one here was particularly fitting as it was the winner back in 2023 when the theme was pain and social life. So before we get rolling here, I wanted to also acknowledge my wonderful graduate and undergraduate students in my lab who have helped to make some of the research happen that I'll be sharing with you today. Funding from SSHRC and UBC and my wonderful community partners, Pain BC and the Bill Nelms Pain and Research Center here in Kelowna. So I'll start with a bit of an overview of where we're going this morning. First, I'd like to give you a bit of a broad overview on some of the research that's been done on social relationships and health in general. And then we'll move to talking about some of the challenges faced by people living with chronic pain in terms of their social relationships, and then try to offer some strategies around how we can improve support for people living with pain, and taking into account the perspectives of healthcare providers, family and friends, and individuals themselves. And I suspect we have some of all of these people here today. Okay. So, of course, we know that humans are social creatures. We have this fundamental need to belong. And if the general population hadn't really thought about the importance of social connection in our health and well-being before the pandemic, they certainly are aware of that now. And in fact, health psychologists have been systematically studying the importance of social relationships and health for over 50 years now. And it's actually been at the core of my own research for almost 25 years. So we have already a lot of evidence showing that social relationships are not just good for our mood, but they're also important for our physical health and our longevity. In a meta-analysis published back in 2010 of over 300,000 participants, almost 150 studies, all of these studies following people across time, the results were very consistent and very striking. It turns out that a lack of social support and a lack of social ties are just as bad for your health as things that we widely recognize as health compromising behaviors and factors like cigarette smoking, obesity, and lack of physical activity. There have been subsequent studies similar to this, and also trying to understand what might explain this relationship. The most recent review on this topic was actually published in 2023 in the top journal Nature, included over 2 million participants, again, all following participants over time, and found that both social isolation and loneliness were related to an increased risk of mortality from all causes, and especially increased risk of death from cancer and cardiovascular disease. So I'm throwing around these terms related to social relationships, one of them being social isolation, one of them being loneliness. I'll pause for a minute just to define these terms, just to make sure we're kind of all on the same page here. So when we talk about social isolation, this is more of an objective factor. So someone who's experiencing chronically over time physical separation from others. And of course, this was something that most of us were going through all together during the pandemic, but this was not a new experience for many people before and after. So someone who rarely leaves their home, rarely interacts with others would be considered socially isolated. This is related to, but different from loneliness. So loneliness is a subjective experience. People who are socially isolated feel varying degrees of loneliness based on the perception of being alone or separated. So it's possible to feel very alone despite having a full household, many friends, coworkers, and so on. On the other hand, one may actually not have a lot of social contact and connection, but not experience a great deal of loneliness. I also want to point out, and this was actually brought up in a recent community talk I did a couple of weeks ago, that actually being alone is not inherently a bad thing, and people have different preferences for how much social contact they want to have, and there's actually more and more research accumulating showing the health benefits of solitude. So I do want to acknowledge that there are differences across people there. But one thing I can also say for certain is that loneliness is a highly common experience among people living with chronic pain. And this becomes even that much more important when we consider how common chronic pain is in our society. So 1 in 5 Canadians live with chronic pain. We also know that it's a leading cause of disability worldwide and can impact every aspect of an individual's life, as well as have this ripple effect to affect other people in our networks and so on. So some of the research that I've been doing over the past few years has been in collaboration with the Bill Nellens Pain Clinic, which is a very large outpatient clinic that treats a lot of people living with chronic pain. We did a survey of almost 1,000 people in the clinic recently and found that almost half of people reported significant loneliness. Okay. And this is really important, not just because of the reduced quality of life, but also because of the mental and physical health risks that we know are associated with loneliness and isolation. And it turns out that pain and loneliness can become part of this quite vicious cycle. So for anyone out there who has pain, who experiences loneliness and disconnection, this cycle might look familiar. So anyone that's living with pain probably also has challenges with energy, fatigue, sleep, difficulty getting around physically. And those symptoms can lead us to withdrawal, to actively or not even consciously avoid social contact, social outings. But the more withdrawal happens over time, the more likely we are to start having these thoughts, these negative thoughts about feeling alone, feeling that nobody really notices that we're not around anymore, feeling that maybe we don't have very much to contribute because we've just been sort of at home managing our illness. And of course, these thoughts are connected to feelings of stress, anxiety, and depression. And then, of course, this forms this cycle where we do also know that these negative emotions and stress can further exacerbate feelings of pain and so on. And then this can become even more complex, especially in chronic pain. That cycle is common in a lot of people with varying chronic illnesses, but pain is an invisible disease. And what does that mean? Well, it means that on the surface, you may be seen as somebody going about the tasks of daily living like everybody else. You're shopping, you're parenting, you're working, you're maybe socializing, helping others. Meanwhile, what people don't see or may not see is the financial stress, the frustration, the guilt, the loneliness, and so on. And I'm going to get to a brighter side of this because this all sounds very difficult, and it is. But there is a role for social relationships in helping to lift us up and help us manage these things. But before we kind of move into that, I also want to highlight something very specific that can happen and unfortunately common experience in people living with pain. And even though for the most part, people are well-intentioned, right? Our support providers, our loved ones are well-intentioned. They want to help, but it may not always feel that way. And there's this construct called pain invalidation. Sometimes it's referred to disbelieving or discounting. And it shows up kind of like this, when people feel like, I think you could be doing more than you're actually doing, thinking that you may be exaggerating your symptoms or getting frustrated and annoyed. And this invalidation can come from a lot of sources. Again, in some work that we've done, we've seen people experiencing this from social services, things like insurance companies, coworkers, family, friends, and healthcare providers. But what's important to remember, and that invalidation comes from a lot of levels, and we'll talk about that a little bit more later as well. But even though experiencing that discounting and invalidation can lead to increases in depressive symptoms. So here on this slide, I'm showing you some results of another study that we did of people being treated through the Bill Nellums Clinic, where the more people are experiencing that discounting or invalidation, the more experience of depression they were having. But look what happens in people who are experiencing high levels of support. So among those people who are feeling supported in their life, even despite this high level of discounting, their mood was not as negatively impacted. Okay, so support is such an important factor in helping us manage various stressful situations. And there's lots of research, including work that I've done, but this is part of a much bigger literature showing that people who are satisfied with the support that they have in their life actually report lower pain. They report less interference due to their pain. They sleep better, they have less stress, they're able to cope better with their illness. And so one of the things that my research is really focusing on these days is how can we improve support for people living with pain? How can we increase access to support for people living with pain, because we know how important it is, especially among people dealing with chronic illness, how important those relationships are. And to do that, I don't think it just is upon the individual with pain to find that support. Of course, advocacy is an inherent part of living with a chronic illness, including chronic pain. But there's a lot of layers to this. At a broad societal level, because pain is this invisible illness, there is a lot of misunderstanding and misconceptions about what pain is. The common response from people can be that it's just must be in your head because you look fine. The MRI looks fine, you look fine. How can you be saying you're in so much pain? So one approach is addressing this issue right at the level of healthcare and healthcare providers. And I want to share a quote from someone who, actually, I didn't check the list of attendees, he may even be here today, but someone who is well known in the pain community here in Kelowna, but also nationally and internationally, is a gentleman named Keith Meldrum. He has been living with persistent pain for decades and has become an international advocate for people living with pain, and specifically around increasing education and awareness about pain among healthcare providers. And some of this mission that he has comes from an experience earlier on in his journey in which he had a physician say, while he was explaining his story and how difficult it had been, this doctor saying to him, "I believe you." And that seems so simple and so easy to do for somebody that's providing care, but unfortunately is not always the case. And that was really a turning point in terms of feeling empowered and able to kind of move forward and heal. And it takes a lot of less energy when you're not having to try to convince people how much pain you're in, right? And it turns out that this concept of validation is getting a lot of attention in the pain research world these days. So kind of the opposite of invalidation. There have been quite a few articles over the past few years. This is just a couple of examples of a number of research groups starting to really pay attention to this. So the importance of validating pain communication, the importance of the social aspects of the pain experience. So what is validation? It's not just the opposite of invalidation. That may not be as helpful of a definition. So it has been defined as this process through which listeners are communicating to others that their thoughts and their feelings are understandable and they're legitimate, right? So I believe you. I may not know what it's like, but I can try to understand and put myself in your shoes in terms of what that must be like. And it turns out that when we feel validated by our healthcare providers as someone with pain, our health is significantly better. And I want to share with you, I wish I had done this study myself. It was a fabulous study published just last year. And this slide is very busy, so I'm going to walk you through what this is all about. Basically, this group recruited almost 1,500 people with lower back pain, chronic lower back pain, and they asked those people to rate their physicians in terms of their level of empathy and understanding towards them. And they were able to group patients based on those who had a very empathetic physician, primary physician, versus those with only a slightly empathetic and supportive physician. And so what you can see here, try to point some of these out as an example. Basically, the top lines here are indicating worse well-being. The bottom, sorry, so the higher the points here, the worse the well-being. The dots in this nice blue here represent patients who had physicians that were low on empathy, and the points in yellow represent patients who had a very empathetic physician. And they followed these people over time, over 12 months. And you can see here that consistently across outcomes, anxiety, depression, function, sleep, fatigue, pain, consistently we see people with empathetic physicians are doing better over time. And not only that, this is controlling for demographic factors, okay, like age, for example, and gender. But when you compare the effects of having an empathetic physician to things that we tend to try to do for back pain, things like surgery, back surgery, opioid therapy, other non-pharmacological treatments, it turns out that empathy was a more powerful predictor of all of these outcomes than those things that we tend to try to use when somebody has back pain. So this is huge to me, and I love that this was documented in such a rigorous scientific way. And this is being noticed by a variety of organizations around Canada and all over the world. Actually, here in BC, we have a health improvement network called Pain Care BC, which is actively trying to address this need for improved pain services across our province, as well as a focused initiative to try to improve training in pain. And it doesn't take a lot, right, to be to validate and believe our patients is a lot easier and cheaper than doing surgery, right? And it turns out that can be, as I just sort of described, just as powerful. So there's a lot of work to be done at the level of the healthcare system. Closer to home, of course, we have family and friends that are supporting people living with pain. And so what can we do from that standpoint? Again, people really, obviously we want to help our loved ones that are experiencing pain, but that's not always an easy thing to do because of the invisibility of pain, the chronicity, just how much it can impact life. And so I will sort of bring up this idea of validation in this context again, but notice that part of that definition is sort of that understanding. We don't necessarily have to experience pain ourselves to recognize that pain is understandable or a response to pain is understandable. But the more we can equip ourselves with knowledge and education about pain, the better. And there are general organizations that support people with pain that I'll mention a bit later on. But there are also lots of wonderful organizations that are specific to certain pain conditions. There are hundreds of specific pain conditions, reasons why people may have pain. And sometimes it helps to understand more about those specific conditions because there's a lot of variability in the types of conditions and underlying causes for pain. And how it shows up in people's daily life. Obviously for migraines, that's something that's going to sort of lie dormant and then come on full force, often unexpectedly, and then again, sort of dormant again. Whereas things like arthritis, fibromyalgia are kind of follow a different path. There are also lots of organizations that support the support providers. Pain BC is one example. There's also a family caregivers organization here in BC that supports caregivers. And so lots of resources there that will help us support those. In terms of specific strategies to support, so how can I support somebody who's living with pain? It's hard for me to answer that beyond the general responsive validation because what people need and personality styles and certain pain conditions vary so much. So the best thing I can recommend is open communication and asking people what they need. As a rule, though, encouraging active coping when possible. So trying to encourage some movement even on those bad pain days, helping people engage in distraction if pain is really flaring up. But at the same time, we know from research that there's a certain type of support called solicitousness or over solicitousness, where it looks kind of like sort of catering, and I don't want to use the word enabling at all, but it's possible to be over supportive. Let's just say that, because individuals have a need to feel competent and independent and autonomous. And so the more we can encourage that and facilitate that, the better. Even though it can feel like we're helping, it may actually be too much support in that sense. And of course, there is a role for the individual who is experiencing pain in terms of increasing connection and that sort of web of support, a network of support. And as I mentioned at the beginning of the presentation, some people may feel quite content with the support that they have, whereas others really feel like this is something they want to address. And it can be hard to sometimes admit feeling lonely. There's a stigma around that. I often listen to a podcast called the Huberman Lab, and the Surgeon General of the United States was on a few months ago, and he, the Surgeon General, spoke about how he experienced a lot of loneliness earlier on in his life. And I thought that was actually really brave and powerful for him to admit that. And he's actually one of the biggest advocates for addressing this issue on a large scale, because it is this universal and common experience. And I think this is also a hint too, right, that it's not a you thing if you're feeling this way. It is so common, and yes, there are health factors that play a role, but there are also these broader societal factors, this overall sort of lack of community that many people are experiencing, busyness, financial stress that's leading many people to have to work more than they would like just to make ends meet. But if this is something that you're interested in addressing, and specifically if you're finding it difficult to find understanding in your support network, there's a lot of value to peer support. And some of the research I've been doing the past few years, most recently, is some work with Pain BC, who offers a wonderful set of pain support and wellness groups that offer the opportunity for people in BC for free, virtually, to participate in these peer support groups where you can connect with other people going through this similar experience. Even though your pain condition may be different, that experience is often very similar. And there's an opportunity to connect with people online that live close to you, but also based on age group or other demographic factors. These have been offered for some time now. I've noticed that some people know all about them and others have never heard of Pain BC. So I want to mention them here, just also to spread the word, but also to describe some of the research that we've done and some of our recent findings in this work. So in participants of these online groups, we are seeing this sense of community being formed, this feeling of support and respect by fellow group members and facilitators who are also people who are living with chronic pain. There is also education that's shared during these groups, tips and strategies for how to manage pain, and that's also a positive experience. I find quotes often are a very helpful way of really capturing an experience. And this quote comes from one of the participants in our study. "By now knowing this resource is here and feeling the common understanding and experience of the group, I finally feel some hope." So I feel like this, I don't even need to show you, I will, the data that's coming out of this, but I think this really encapsulates the experience of many. So in our initial analysis of the data, so we followed these group members over a period of 12 months. After the first 3 months, we are starting to see a small but significant improvement in pain and sleep. Also, some emerging evidence to support reduced loneliness and interference due to pain, and an increase in participation in daily activities. But I do want to acknowledge that not everybody has the capacity to participate in these or the interest. They are offered twice a month for 2 hours. There is a lot of flexibility in terms of just, people are encouraged to just come as they are, regardless of how they're feeling. Yet still, there can be scheduling conflicts with other responsibilities at home, for example. Fatigue and energy can also be a real legitimate barrier. Just lacking time, again, due to competing demands. And a small proportion have also expressed some negative group experiences and so on. But again, facilitators are trained to manage and support those issues. So evidence from our research, as well as broader research on the benefits of peer support, does suggest that this is one way, not the only way, to connect with similar others. Another area of research that we are conducting in my lab is specifically looking at social media as a potential source of social connection. Now, I know that most of the headlines that you see in the news are not good headlines about social media, and I definitely don't want to ignore or minimize these. So there is absolutely, evidence that there's a lot of negativity, especially on certain Facebook groups, for example. This can be a place where people sort of almost obsessively check bad news about what's going on in the world. There can be a lot of comparison with others that may seem like they're having a better life or happier than you are. But a really important upside that has actually been looked at long before there was such a thing as social media. These online communities can offer a great source of support, especially for people that are, for example, living with a very rare condition, when there is nobody you can get together and have a coffee with to talk about this experience because there's maybe 20 of you in the province. But there are these groups that exist online specifically for chronic pain. This is one example of one. It's not an endorsement of it, but just an example of one group that is out there. And what we found from our research is that while there is very mixed and complicated findings when it comes to the connection between using social media and mental health and well-being, that there seems to be something different going on with online groups. So we recently published a review of the literature, over 140 studies looking at active versus passive social media use. So just to define those for you first, active social media use refers more to actively engaging and interacting with people while online, whereas passive social media use refers more to the scrolling and just sort of reading and observing what's going on social media without actually actively interacting with anybody. And typically passive social media use is sort of thought to be associated with negative outcomes. In our review, we did find some evidence that passive social media use is associated with some worse mental health in general, but when you look at passive use on social media groups, we don't see this negative effect. So what I think is going on, because a lot of the groups that were in this study were actually groups for people with chronic illness, mental health conditions, physical health conditions, that just being able to log on and just read people's comments, see people's suggestions and support being exchanged, that in and of itself could be quite helpful. If you are not a fan of online support groups, if you're not on social media, Of course, there are many other ways. So just to wrap up this piece of the presentation, I'll talk a little bit about some other strategies that may help break out of the cycle of loneliness and isolation that can be really common in people living with pain. There's been a lot of research actually looking at what interventions are effective for reducing loneliness. The problem is that they are not widely disseminated and accessible. So we do know some things that tend to be effective, but it's just a matter of how can we sort of put this into practice on a larger scale. To begin to reconnect or cultivate existing relationships, it helps to be strategic and flexible. So if you are somebody that has been feeling isolated and lonely for a long time, this is not something that is going to just improve overnight. Relationships take a long time to develop and build, even though we may connect quickly with people. Those strong bonds do take time. And so maybe it is about just connecting with an old friend. And if even that seems difficult, maybe it's just, hey, let's actually just start interacting. If we're out to get groceries or to get a coffee, have a quick chat with the person that's working there. Those are some of the little things, those little in-person interactions with what we call weak ties, people that are just acquaintances or people maybe that are even strangers, that can give us this boost of feeling connected, that is unique and independently associated with well-being, with positivity. There was a really neat article a couple of years ago actually about this checkout line at a Sobeys close to Edmonton, where there was purposely somebody that was working a slow checkout line where it was encouraged to actually chit chat and connect, which I thought was so awesome. We need one of these, and we need a Jason at a Save-On here in Kelowna. It can, again, back to that point of being strategic, planning activities for when we know our pain and fatigue will be lower. For some people, that's earlier in the day. For some people, it's later in the day. And having contingency plans. So, okay, rather than an all or nothing thinking of, my pain is really bad, I don't think I can get out today to meet up for a walk, let's pivot to a phone call or FaceTime. It turns out, at least based on my research and others, that video interactions can actually be just as beneficial for mental health and connection as face-to-face. So it does count, it does matter. A final strategy that I'll share is making social time purpose-driven. Because energy and time are often limited when living with pain, it can help to identify your values and interests and make sure that whatever you're spending your time on when you do have that energy and time is something that's important to you. And, you know, even if you are actually unsuccessful at doing this with somebody else, that you're still doing something in line with your values. So if your friend cancels on a walk, can you still go, and at least you're doing something and getting benefit from the activity and the fresh air. So identifying activities that you're interested in and that increase the opportunity for social connection. So we can't control other people, but we can put ourselves in situations where we have the opportunity for social connection, and the rest is sort of up to the universe in that sense. So if it's physical fitness, joining a walking group. If it's just sitting outdoors on a park bench, pick the park bench that's close to the playground or close to an entrance where there's more traffic. There's a greater chance of having somebody sit down beside you and you can have a little chat, strike up a conversation. Maybe that person is also going through a difficult time, and you can, or you could just chat about the weather. Volunteering is another great way to do this. Joining a group that's based around music, arts and crafts, painting, gardening. And so in the meantime, you can be this person you want to be, whether that's adventurous or creative, and then letting the rest kind of fall into place. The last thing that I will share is around the importance of not just connecting to others, but also taking advantage of the community resources that exist out there in our community. Pain BC, I've mentioned already, I'm obviously a big fan, has these peer support groups, but also a lot of educational resources available. They have a support line that you can call and get information. Power Over Pain is a new web platform that offers a lot of resources and support. It's all vetted by pain professionals, so the quality of that is assured, and it's all free as well. Same with Pain BC. The People in Pain Network also are a great organization who run peer support and offer education and so on. So even though the experience of pain can be very isolating, challenging, and at times invalidating, there are a lot of organizations out there that are available to support you and help you connect to others. I actually feel some really great optimism as somebody who's been studying pain and social relationships for over 25 years now, that we are getting more attention to pain. The Canadian Pain Task Force published this wonderful piece of work recently that highlights the impact of pain in our country, and it is getting attention and funding, which is really so needed. Pain comes up in so many different conditions and diseases and various life events that it can be easy for people to feel scattered and alone, but there are these groups coming together to provide support and increase awareness and education. So I hope this information was helpful. And that is all that I will share today. I'd love to hear any questions or comments that you may have. Thanks so much.
Well, thank you so much, Dr. Holtzman, for your sharing for that. I'm pretty sure we all learned a lot today for that. And just a couple comments and from the participant group. And then so Naomi's and who live in Yukon is also shared that, and the Pain BC support group for that, and also support like people or participants outside the province for that. If you are joining us today, is outside BC for that, you might still want to check out so the Pain BC website for that. So we do have our first questions for that, and Naomi says, thank you. And then some questions, do you think there will be, or are you seeing progress in the way of healthcare providers recognizing social interactions and social events as treatment? So she's thinking, and sorry, it's a long email for that. She's thinking specifically about, for example, a medical transportation service like the handybugs, and so it's a long one, and only available for medical appointments. And she also learned of a care team that was able to provide or get fundings for massage or one of their clients so that they could have regular human touch. And however, she found that this is quite rare and not yet recognized as a real medical justified treatment. So Susan, do you have any thought about this?
Yes. Oh, thank you. Those are such great points and great examples of where we could help increase access. I think sort of at a broader level, pain education is extremely limited for physicians as well as allied health professionals like psychologists and physiotherapists and so on, which is surprising because it is so common and such a huge part of people's daily medical and health practices. So the organization that I mentioned earlier, Pain Care BC, is an example of where there is a push to try to improve education for healthcare professionals. The Canadian Psychological Association is also in the middle of developing extra training for psychologists who invariably are working with people with pain. So there is definitely some progress and action kind of going on behind the scenes right now around that. Some of the examples that you provide are definitely these policy level issues that I hope organizations like the Canadian Pain Society can help advocate for, because that makes you make a great point. If people can't physically access due to transportation, for example, that's a real barrier. What was I going to say about that? There's also a trend that I've seen in encouraging giving social prescriptions. So and also nature prescriptions. So it sort of goes around with the education and awareness of loneliness, because it's been named this sort of epidemic worldwide. We are starting to see, like, the World Health Organization, for example, advocating for giving social prescriptions. So if we start having physicians say, hey, you actually need social connection for your health, you need to be able to connect and access support, then that could be another route. If it's actually coming from a physician that's being recognized as an actual intervention. And we've seen that from the study of people with back pain, that it is an intervention just to validate. It's just as effective as medication in many cases. So yeah, really great points. Thank you.
Thank you, Susan. So we do have a second question, and Rachel, by the way, for that, she really loved the slow checkout line earlier.
Oh,
she
yeah.
presents that idea for that. And Rachel do have a questions for that. And she's curious about what you might suggest in the situations where a patient with chronic pain feels well supported by their one caregiver, but this caregiver is completely burned out, and especially in the remote communities, for example.
Okay, so the suggestion for the support provider, for example, if I'm understanding that correctly, this is a really common phenomenon we see in caregivers, is that there are health risks associated with caregiving, because we can burn ourselves out because we're giving and not filling up our own tank. And there can be guilt associated with taking time for yourself if you are also caring for somebody else. And so getting past that guilt can actually be a really important part of that. And connecting with other caregivers can be helpful in that regard. And just some basic problem solving, sitting down with a family member, caregiver, and just scheduling it in, right? Okay, this is the time, this is the non-negotiable time where I'm going to go do something for myself. And if maybe it's not even every day, maybe it's just once a week, but that there's this protected time. And that advanced planning and problem solving, it sounds sort of simple, but sometimes that's kind of what it takes. The same with going to the gym. There's lots of research say if you put it in your schedule, it's more likely to happen. And so some just basic problem solving around that could also help.
Well, thank you for that. And then the kind of ask for that, so whether we can share the resources and also the links through emails for all our participants for that. And we can definitely coordinate this with our institute for that. So, and you will receive our survey. So I believe that we also will send out those additional information and resources to you all for that. And thank you for that. And I believe that we have a comment from Emily here for that. And this is a great reminder for those of us that work in allied and healthcare And for instance, Emily work as a massage therapy, so that we can also connect our patients to other resources such as like the pain disease and many other peer support groups Susan mentioned today. So it could be frustrating as a provider when pain remains chronic. But now we all be remembering that to continue to validate people despite discouragements for that. And thank you for these comments, Emily. And Susan, feel free to kind of add on your reflection.
Yeah, no, absolutely. I think there can be sometimes when physicians or other healthcare providers are suggesting that someone with pain join a support group or see a mental health provider, it can be interpreted as like, there's nothing I can do. It's just in your head, or now you just have to figure it out on your own. And so there can be just a subtle shift in the messaging around that when we suggest support. It's not, well, okay, now you're at the end of the line, try this. It's no, we know that pain is a biopsychosocial experience, and we can, part of treating pain is addressing all of those things. And we just know that from decades of research that the best way to treat pain is to address the biology, the psychology, and the social aspects. And so it's just part of a treatment plan for anybody with pain is to make sure that all of those areas are being addressed, rather than, oh, well, nothing we can do with the medication or the physical therapy. I guess you have to go just talk about it with these other people that have pain, right? So there is it's the same behavior, the same treatment recommendation, just different messaging around it.
Thank you, Susan, for that. But we still have around 5 minutes for these sessions and for Q&A for that. So please feel free to type your questions in the chat box. We will handle that. And I do have one question, and Susan's for that. And I know it's like caregiver is a very important individual is supporting the patients we are talking about here. And also at your talk for that, you also talk about the financial burden. And it's the double hit for that, because like the patients, of course, like that will impact his or her productivities or the work stability for that. But at the same time, if someone is a caregiver, if someone experiences chronic pain, and this also impact that caregivers like job opportunities or job stability for that. And can you articulate a little bit like how these kind of how employers, or that might be a call for the governments to think about kind of a benefit to the caregiver in addition to benefit or support to the patients? Again, just some thought here. Thank you.
Yeah, no, thank you for that. The lack of recognition of the unpaid work of family caregivers is a long-standing issue, and it's unfortunately, I don't know of any wonderful solutions to this on the near horizon, but it is continuing to be a real issue. And typically the way employer benefits work is you could get time off for a discrete amount of time, right? You can take a leave around a specific situation, but when you're supporting somebody over months and years, those types of benefits don't really work. And it is not to, I hesitate to say it work in the sense that most caregivers want to be doing it. They don't even see it as caregiving. It's just, this is what I do. I have a loved one that's ill. I want to support them and doing everything that I can. But it is work in the sense that it is taking time out of a work day, let's say, where people are unable to be otherwise paid, and there is no funding that you get to do that work at home. So, advocacy, and I think the Alzheimer's Society, that's where one of the biggest groups of caregivers and research around caregivers is happening. And I think if we're going to see that have movement, I'm guessing it'll come from, I would guess there would be movement from that group, from that advocacy.
Thank you. Well, we have one more question. Is highly likely our last questions for today's for that. And Natasha says, "Thank you, Susan. Wonderful talk." And then, so what can healthcare providers do to better acknowledge and address the disparity. And then so disparity in pain treatment based on ethnic and racial differences. And given that historically the pain of ethnic minority, particularly Black or Indigenous or other people of color, are less likely to have their pain taken seriously by healthcare providers for that. And I think there's some systemic conversations here. Please go ahead. Yep.
Yeah, thank you for mentioning that. That is, I mean, there's so many layers to the social experience of pain, and that is definitely, as you said, Dr. Lee, this systemic issue. And it's absolutely true that ethnic minorities, historically marginalized groups are actually more at risk of experiencing pain. So we see higher rates of pain, for example, in Indigenous populations. But so higher rates, but less willingness to access treatment, poorer functioning, greater disability, and so on. And there are in healthcare settings there is more work being done to create more culturally safe environments where that is recognized, so people feel actually comfortable even coming to see their healthcare providers. And there are cultural barriers and ways of thinking about pain even that prevent people from seeking treatment. This a sentiment, for example, that I need to just push through and pain is just part of life, so I need to just keep going, and I don't, sort of this stoicism. And so I think that's coming from multiple sides too. Is how safe do people feel? Is there trauma involved that is related to the pain? That is a whole other thing that we haven't talked about, but there's a huge link between physical and emotional trauma and chronic pain that can prevent people from seeking support because of shame and stigma and mental health conditions. So that is, yeah, I don't know if I can provide a great solution or answer here, but just to say that that is sort of those cultural aspects in creating sort of trauma-informed care for people with pain is hugely important, and is one of those things that is starting to percolate and become more adopted, although we have a long way to go.
Yeah, I agree for that. And thank you, Susan, for that. Yeah, it's definitely, I think today's we are open up more questions.
Yeah.
And then so for ourselves for that. And again, we have a couple minutes for that. I would like to thank you, Susan and Dr. Susan Holtzman, for the wonderful talk and sharing today for that. We all learned a lot. Thank you so much for that. And thank you everyone to enjoy his wonderful questions and wonderful comments here for that. And please do continue kind of like finding time to join our future events organized by institutes for Embracing Aging Month. And so if you want to check out more details about our future events for that, you can visit our website, Okanagan Embrace Aging.com. So I would just put this in the chat box with that. And then .com. And then so we will also looking forward to grow this event in the Okanagan regions and beyond for that. And then so you'll be interested in support Embracing Aging in the futures for that, please do contact us for that. So we'd love to have a chat with you and to explore how we can partner with each other in the future. So to end this talk for that, you will receive an email about the surveys and to get some feedback about, and then so this talk for that, but also like what I mentioned earlier for that, we will try to email you the resources and different links, and then so to the organizations, and today we covered today's for that. And we do record this recording. If you just I forgot something, you want to come back for that, feel free to check out our institution and the YouTube channels for that and our website for that. And thank you so much for that. It's a beautiful summer day, well, not summer day, spring day for that. And then so do enjoy the sun. And thank you so much. I look forward to see you in the future for that. Thank you. Thank you again, everyone.
Thank you so much for joining today.